Yes.
Topic on to determine the risk factors and visual outcomes of non-arthritic anterior ischemic optic neuropathy in patients below the age of 50 years. Non-arthritic anterior ischemic optic neuropathy is characterized by acute, painless, and usually monoocular optic disc edema with visual impairment. It is most commonly seen in patients above the age of 50 years, and it is the second most common cause of permanent optic nerve related visual loss after glaucoma. So a mechanism of NAION is hypo or non-perfusion of the optic nerve head and structurally small optic disc. So risk factors of NAION include disc cartilage, older age, vascular diseases like hypertension, diabetes, obstructive sleep apnea, blood loss due to many surgeries, various medications and other ocular surgeries. So occasionally NAION also occurs in patients younger than 50 years of age. So in our studies, we are assessing the patients below the age of 50 years because these are often misdiagnosed as optic neuritis and papillitis, leading to inappropriate workup and management. In our study, we have evaluated the ophthalmic and systemic risk factors and visual outcomes of patients diagnosed with NAION. So this is a retrospective analytical study performed at Arvind Eye Hospital, Tirunelveli, and the data collected from 2022 to 23. 30 patients with recent onset of NAION were included in this study. Inclusion criteria for the study was patients below the age of 50 years and patients presenting within 2 weeks of onset of symptoms, that is sudden painless loss of vision, RAPD, swollen optic disc with or without hemorrhages, and of course patient giving consent for study. Exclusion criteria were giant cell arteritis, perioperative ischemic optic neuropathy, patients with severe NPDR, PDR, DME and no follow-ups. So data collection was demographic information of the patient was collected, medical history, medication use, symptom course, paraclinical evaluation, neuroimaging and visual outcome. So results were 30 patients with recent onset of NAION were included and mean age was 45.8 years, which ranged from 21 to 50 years. Females were 13 and males were 17 in number. So in our studies, we found that diabetes mellitus played a major risk factor, which was present in 70% of patients, followed by small CDR ratio and hypertension. So in most of these patients who presented below the age of 50 years, visual improvement was good. Visual field defect was present only in 47% of the patients, and the most common defect was inferior altitudinal defect. So results were the most prevalent risk factor for NAION in our patients was diabetes mellitus, 70%, followed by small CDR, 56.6%, and which was followed by hypertension, 50%. Visual recovery was good in these patients, and logMAR visual acuity was 0.42. Discussion. So similar study which was done by Bhelani et al. It was risk factors and visual outcomes of non-arthritic anterior ischemic optic neuropathy in a tertiary center in Kuwait. This was also a retrospective study. The study duration was from 2006 to 2019. So in there, the most prevalent risk factor in young patients was small CDR ratio, 68.7%, followed by smoking and diabetes. And in their study also, patients below the age of 50 years had better visual outcome. And in their study, the older age group, diabetes was the major risk factor, followed by hypertension. In another study presented by Turkoglu et al., that is a captioned non-arthritic anterior ischemic optic neuropathy in young patients. This was also a retrospective comparative study, and review of medical reports of 120 patients was done. So diabetes was present in 63.6% of young patients. That was diabetes mellitus was the most important cause in younger age groups. And hypertension was associated in the older age groups, and there was no difference in the visual outcome of these patients. So conclusion, patients having systemic vascular diseases and small cup to disc ratios, they have increased risk for developing NAION in age younger than 50 years. And awareness about these preventable risk factors like diabetes and hypertension may help to reduce the incidence of NAION in these patients. Thank you for patience hearing.
Thank you.
Why are all patients, how many you have the visual field defect? 46%, right?
Yes, ma'am. 47% it was present.
Yeah. How many is the disc change? Disc change? Any disc change you have noticed?
Disc changes. Ma'am, small CDR ratio was present in most of the patients, and in visual fields, inferior altitudinal defect was seen in these patients.
Yeah, so why do you think, you have only 46% altitudinal defect? You have altitudinal defect, right? Inferior altitudinal defect.
Yes, ma'am. Yes, ma'am.
Can you explain?
That is only what we found in our study, that visual defect, like compared to other studies, visual defect was present in less patients in our case, in our study.
Thank you.
Thank you.